Waldenström's is one of the close cousins of multiple myeloma, and it's unlike myeloma, it's a disease actually which has a very, very consistent genetic basis with highly recurrent mutations in a gene called MYD88 occurring in about 95% of patients. And this recurrence allows us to be able to really dig a bit deeper into what the subtypes and evolution of Waldenström's is. And so one of the things we've been able to learn is actually there's additional mutations in CXCR4 that modify this MYD88 gene signature, and that happens actually during this sort of transition from the MGUS to Waldenström stage, and has really important clinical presentation differences and also impacts on subsequent therapy, including therapy with the BTK inhibitor ibrutinib. So patients with these CXCR4 mutations will actually have a much delayed response up to 6 weeks later, and also will not have the same depth of response as those who are wild type to CXCR4. Additional mutations that we see in Waldenström's are deletions in 6q, which is actually one of the rare points of overlap with multiple myeloma. In both diseases, we see deletions in 6q associated with gains in 6p. In the case of Waldenström's, this again is actually a mutually exclusive event with CXCR4 and represents a different evolutionary track of Waldenström's and how it progresses from the MGUS phase into active WM disease. And this overlap between the two diseases is an area of active research, some of which we're presenting here at the workshop today.